Hello, good evening, friends. I'm so sorry for the delay, and there was some technical issue. I was not able to. Shall we start? Good evening, all of you. Good evening, all of you. Thank you so much. Thank you. Okay. Can you please tell me? Shall we start? Are you able to hear me? Am I audible to you? Hi. Yes, hello. Thank you so much. So this session is purely a harrison-based session, and I want to make sure that you find Rickettsia ultimately easy. Thank you very much, all of you. And I'm so sorry for the delay. Good evening, all of you. Okay, now... Okay, so yes, thank you so much. Before we start, let me tell you a few things. This is Harrison's 23rd edition based Disease MCQs, and this is nothing to do with any copyright images. We'll not be using direct images from Harrison. I'll have a combination of multiple concepts from different sources, but I'll use Harrison's words as the most important reference to bring to the accuracy of these pictures. And this is Dr. Meenakshi Sundaram, and these are my credentials before I begin. And I'm a gold medalist in MD exams, and I'm a high octane educator for biochemistry and microbiology for the past 11 years. And there's something called as plus subscription on Unacademy, and you can subscribe to Unacademy by using my code Dr. ASM Live, DRASM Live, and you'll be in for daily live classes, structured courses, live tests and quizzes, unlimited access to any kind of class you look for. There's something called as iconic subscription, where you'll get the best of Unacademy and the best of Rep Ladder. This is recorded videos, and this will be live classes, and you'll be having quizzes and rapid revision courses on both. And these are the upcoming live classes you'll be looking for. There is next PG, next free test series, and the free test series are happening on 7th, 14th, 21, and 28th March. So if you have missed on 21st March, the next one to take is 28th of March. On 28th of March, we have pharmacology plus anesthesia, and FMGE free test series will be having the pharmacology plus anesthesia for 28th also. Every day daily, next T22. And there is a batch course for FMG 2021 and target next PG 2022 batch course. And I have done a batch course in next August evening, 24th of March, and I have done 54 classes in microbiology. And if you could use my code DRASM Live, you will be able to have 10% discount on the referral code and exclusive access to all my classes. Now, this is how you can download the Unacademy app. On the Unacademy app, open it and then go for PG, NEET PG Live, and you can look for the subscription. And these are the different kinds of rates for the subscription, and the more the duration you take, the more the discount you get. This is Dr. ASM Live, the code. Now, there's something called as Revisathon, 1 hour, 45 questions every Sunday, 5 to 6 p.m. This is what you have to know. And if you have missed till now, from 28th March, 4th April, every Sunday till you have exams, you'll be having 1 hour of 45 questions each. So let's begin with Rickettsia. Sorry for the trouble. So let's begin with one question. Then we'll go for the options. Then I'll tell you the theory part behind what exactly is to expected. Come on, people. Yes, good evening, all of you. Now, what is your answer, people? Among the following, which does not belong to Rickettsia family? Orientia, Ehrlichia, Anaplasma, Neo-Rickettsia, Candidatus Neo-Ehrlichia, Coxiella. Options: A 2,4, B 4,5, C 1, 2, 3, 4, 5, D 1, 2, 3, 4, 5, 6. None of the above. Don't worry about the answers. We'll discuss the theory and then we'll go for MCQs. But just to have a headshot at it, I'm just showing you one MCQ. Come on, people. What is your answer? See, pick the answer among A, B, C, D. This is how we train ourselves. This is new pattern MCQ. New pattern MCQ for NEET PG 2021. It's a very new pattern. Try to give me an answer. Okay, Ritika Saini says C. She says 1, 2, 3, 4, 5. Okay, Ramnan Salraj says A 2,4. Any other options? Okay, Senthil Kumar says E. Kanaga Sundar also says E. Saramsh Agarwal says E. So 2 people for A, 2 people for E, 1 person for C. Any other answer? Any other answer, people? Okay, so let's stop at this. Yes, now we have many options, B, C coming up again and again. So the right answer is none of the above. Don't worry about this question. This question is a teaching MCQ. This is to teach you in the family of Rickettsia, we have so many organisms. We hear Rickettsia as a very common word. But please take into account that there are other names which come under Rickettsia, but they are not called as Rickettsia. Orientia is an example of Rickettsia. Example Orientia, Sutsugamushi. Ehrlichia schaffensis. Anaplasma cytophagulum. Neo-Rickettsia. Candidatus Neo-Ehrlichia. Coxiella Burnette. All these organisms belong to Rickettsial family. Did you understand this part, people? Yes, join Matthew. They'll be available as PDF also. Yes, they'll be available as recorded classes also. Now, did you understand my point here? I'm just telling you, this is a teaching MCQ. All the organisms belong to Rickettsial family. So when they say which one does not belong to Rickettsial family, the answer is none of the above. Now, let me tell you some kind of stories. Would you be happy to listen to certain stories as how to remember Rickettsia? Come on, people. Please respond faster. Okay, so it was in the year 2010. I started teaching MBBS students to prepare for MD, MS exams. This story dates back very long ago. Yes, so let's go for the stories here. Listen very carefully. See, we start with one concept. There is a person who rides a bike, and say this bike is Kawasaki bike. Say this bike is a Kawasaki bike. He is a very strong lover of biking. So he keeps his bike very clean at the cost of himself. He doesn't take bath properly. No taking proper head bath. No taking proper head bath, but he can wash his bike every day very cleanly. So his bike will be shining, but his head is absolutely dirty. It is lice infested. Now this biker, when he wants to ride the bike, will he sit under the bike or on the bike? He will sit under the bike or on the bike? He'll be sitting on the bike. On in Latin has an epithet that is called as epi. If you want to sit on the bike called as Kawasaki bike, and you are taking care of your bike very well compared to your own body, you'll be lice infested. Now, because you're riding a bike, you'll be wearing proper gloves and socks. It means you will be having proper covering for anything that is required for riding a bike, but you don't have proper kind of covering for your whole body. Now, this can be converted into a story for Rickettsia. Kawasaki bike sounds like Prawazeki. The vector transmitting is head louse. And epi is on the bike, it is epidemic typhus. And because this fellow is wearing gloves and socks, the rashes can be present all over the body except on the palms and soles. Except on the palms and soles. This is the simplest way of remembering the story. Did you understand this? Did you understand this story, people? He rides a bike, which is Kawasaki bike. That sounds like Rickettsia prawazeki. It is a causative organism of the disease called as epidemic typhus, and he will be having rashes all over the body except in the gloves and socks area. So there is no palms and soles involvement. He can have rashes all over the body. Did you understand the story? I hope it was useful. Was I clear to you? If I was clear to you, shall I continue with one more story for you? Okay, shall I tell you one more story? Okay, now look at Japanese sumo wrestlers. Japanese sumo wrestlers. Are they heavy people or very slim people? Are they slim people or very heavy people? Japanese sumo wrestlers, are they heavy people or very slim people? They are heavy people, so they look mighty. And these people are Japanese people. They won't have names like Ramesh, Suresh, Sharma, etc. They'll be having names like Buski, Suski, Buski. Now, look at this part. These Japanese sumo wrestlers have Japanese names, and before going to a wrestling competition, they will take proper bath. They take proper bath. And how do they take a bath? They'll jump into a tub and they'll use a scrubbing towel and they'll scrub themselves very properly. They scrub themselves very properly. They are committed to the wrestling. They respect wrestling more than anything else, and so they will go always clean into the wrestling arena. So they scrub themselves very properly. Scrub is actually reminding you of scrub typhus. And you understand these people have Japanese name. And the only name that sounds like a Japanese name would be Tsutsuga Mushi. And what kind of people are they? They are mighty people. And it sounds like what? Might being the vector. And what might is it? It is trombiculid might. It is trombiculid might. Trombiculid might is the vector. Rickettsia Tsutsugamoshi is the causative organism. And scrub typhus is the disease. Did you understand this part? When you're okay with this, tell me, I'll go to the next slide. I do not want to tell you a story which is not understandable. See, I am very poor in mnemonics. As a human being, I am very poor with mnemonics. But there are certain times where you will not be able to have logic behind every single condition. The name and the organism and the vector and the disease may not match. So how do I remember it? By telling some stupid stories which you can laugh at it later. So if you're okay with this, I'll go to the next one. Tell me. Did you understand this? Please put a thumbs up if you're okay with this. Okay. Now let's go for the third disease. Now imagine in South India, elder sister is called as Akka. Elder sister is called as Akka. Now imagine you go to the college, but there is a major exam in the college. You forgot your lunch. Now ask yourself, between Akka, who is your elder sister, and Anna, who is your elder brother, among the two people, if at all you have both Akka and Anna, who will be very concerned about whether you ate or not? No, Bhargava Sitaraju, it cannot be heart tick. Scrub typhus has to be trombiculid mite. Scrub typhus has to be trombiculid mite. Trombiculid mite is the vector. Heart tick is a very less common phenomenon in spreading it. Okay, so when you think about it, if at all you forgot your lunch when you go for the college in a major exam time, who will you think will be concerned about you having food? Anna will say, buy some kind of food and just forget it. But Akka will say, oh wait, let me give you some kind of food. She'll prepare some food and put them in a box and come rushing to the college and gives you the tiffin box with the help of your food. The tiffin box with the food. Akka is sounding like Rickettsia akari. And the box is sounding like pox. Rickettsia akari will cause rickettsial pox. Did you understand this part? Rickettsia akari will cause rickettsial pox. So, Akka, elder sister, you forgot your lunch. You're calling both Akka and Anna. Who will respond to you? Akka responds because she is more emotional than that of Anna. Anna will say, it's okay man, if you don't take your lunch, it's fine, you won't die. But Akka will say, you have to take your lunch. So she prepares lunch, puts them in a box and comes rushing to you and gives it to you in a tiffin box. Box sounds like pox. Rickettsial pox, Rickettsia akari. Now, not all the stories will be lengthy and all will be extremely entertaining. But if it can make you laugh, it can make you feel like it's a stupid story, that is enough. The stupid stories will stick to our mind faster than that of any kind of deep knowledge screenplay based stories. Now, let me tell you one more story. Now, what kind of people are Indians? We all Indians are generally middle class people. Of course, we have very rich people among us. We have lower middle class people among us. But most of the Indians belong to middle class. And what is middle class mentality? In all the other countries, If at all there is plastic waste, the waste will be floating in the oceans, but not in Indian Ocean, Bay of Bengal, Arabian Sea. Why? Because all the plastic covers are lying inside the human houses of Indians, because we are going to use every plastic paper for some or the other rules. So we always try to use something more than that. Now imagine you are going to buy ice cream for yourself, and whenever we buy ice creams, they can give ice creams either in the form of cups, paper cups, or in the form of cones. We being Indians, what do we choose, cups or cones? What do we choose, cups or the cones? Because when we are paying for the ice cream anyway, you will ask for an ice cream placed in a cup or in a cone. Cone. Why? Because if you finish your ice cream, you want to make the best out of the money you're spending so that you can eat the cone, which is made up of some kind of biscuit material. That is Indian mentality. Now think of a disease called as Indian tick typhus. This Indian tick typhus, Indian mentality, and we'll be using cone ice cream for any kind of ice cream than a cup ice cream. Cone sounds like conori. Rickettsia conori is an organism who causes Indian tick typhus. Did you understand this? Yes, Ashmeet Sura, that's the right answer. Indian tick typhus, Rickettsia conori. Is that fine? Okay, excellent. Now let's look for the next organism. Now imagine you have a small party in your apartment building. Imagine living in an apartment building, and in the small apartment building you have suppliers bringing all the kinds of food and the water. Imagine this is a huge tank of water placed on a tripod stand. Imagine small children playing everywhere, here and there. The small children are running here and there, everywhere. Now all the elderly people are very worried. What if these children can knock any tripod and the whole tank topples? When the tank topples, the water will hit the face of every single human being who is a child. Now take for example, I take some amount of water and spray on you, you just get sprayed. If I take a jug of water and I throw on your face, you become wet. You become wet. But imagine a tank full of water falling on your head. What happens? What do you call it as? You call it as drenched. Now imagine this tank full of water contains 100 liters of water. And remember, 1 liter of water is equal to 1 kg of water. If I have 100 liters of water, which is equal to 100 kgs of water, what is the simple name for 100 kilograms? See, 1000 kilograms is 1 ton. 100 kilograms is, what is it referred to as? It's referred to as quintal. 1 quintal is equal to 100 kilograms. So 100 liters of water, which is equal to 100 liters of water, when it falls on the human beings, it is 1 quintal of water trying to drench a human being. Drench sounds like trench fever. And quintal sounds like Rickettsia quintana. Quintal sounds like Rickettsia quintana. Did you understand this? Are you okay with this story? Okay, thank you so much. Now, so let's look at these once again. We can rewrite whatever we learned. Now, let me tell you one more story. With this, we can summarize whatever we have learned. So, kindly move screen to left side of screen. What does it mean? Kindly move screen to left side of screen. Okay. So here, in this particular scenario, I wrote quintal here. Sorry about that. 1 quintal sounds like quintana, which is Rickettsia quintana. And you have drenching, that sounds like trench fever. So these words you might have missed. I'm very sorry about this. Okay, now let's look at one more story. Now, can you tell me what is a common name given for pathologists, microbiologists, radiologists, and biochemists. All these 4 people are belonging to a department called as diagnostic medicine. They are important for running tests to make a diagnosis. Now imagine if I'm a microbiologist and I am concerned about a diagnosis. I can think of many concepts, but I'm not able to arrive at a diagnosis. That makes me a psycho patient. I turn suddenly hysterical. I become very hysterical. I am pacing around the room. I'm standing in a room. I'm walking here and there in the room. I'm not able to make a diagnosis. Suddenly, a particular attender walks in and says, "Sir, if at all you're not able to make any idea about it, why don't you take a walk outside?" So I decide to take a small walk. Now I'm coming out of the diagnostic department and I'm taking a walk like this. And I'm walking and walking and walking, and I'm continuously thinking about what the diagnosis can be. I'm thinking what the diagnosis can be. So after a long time, I realize the time has slipped away. Suddenly it has become dark. And I realize I have come to a mountainous area. This is not a regular area. I have come to a mountainous area. And in the mountainous area, I am very tired and I sit on a small rock in the mountain. The moment I sit on the rock, suddenly the strike comes. I'm making a diagnosis, like how Archimedes kept on shouting, "Eureka, Eureka, Eureka," so many times. The moment I make a diagnosis of Rickettsia, I keep on shouting, "It's Rickettsia, it's Rickettsia, it's Rickettsia." I become hysterical. I keep on shouting Rickettsia. So when I keep on repeating Rickettsia and Rickettsia so many times, it can resemble Rickettsia, Rickettsy. And where did I go and sit? I sat on the rock. Where was the rock? It was on the mountain. Rickettsia, Rickettsy is the causative organism for rocky mountain spotted fever. Did you understand this? Is that okay? Did you understand this? Excellent. So let me summarize all the conditions. Rickettsia, Rickettsy. What was the story? I told you about the diagnostician who keeps on repeating Rickettsia after making a diagnosis. So it is rocky mountain spotted fever. Then I spoke about Japanese sumo wrestlers. How do the names suggest? The names sound like Japanese name. Rickettsia Tsutsuga Mushi. Rickettsia Tsutsuga Mushi will be for the Japanese sumo wrestlers. They take a proper bath before going for any wrestling. They scrub themselves very properly. It causes scrub typhus. Then I told about the Indian mentality. We generally want the most out of what we invest. So we choose a cone ice cream than that of a cup ice cream. So Indian tick typhus. Next we have Rickettsia Prowazeki. Prowazeki sounds like Kawasaki bike. And where do you sit on the bike? You sit on top of the bike. That is epidemic typhus. And there is Rickettsia Quintana. I told you Quintana sounds like quintal. 100 liters of water, if it falls on you, you get drenched. Drenched sounds like trench fever. Then we have your akka coming rushing to you when you are actually hungry. Your akka will bring food for you. And when she brings the food will be in the small tiffin box. So the tiffin box will be like pox, which causes rickettsial pox. So the 6 major conditions and organisms have been put in front of you. Did you understand this? Okay, Rickettsia acarius, rickettsial pox. I'll write it here. Okay. Now there are some other organisms which can be slightly helpful for you. What are the organisms? Look at this. We have Bartonella, which can be called as Quintana, and under Bartonella we also have something called as Henselae. And Bartonella henselae is the one who causes cat scratch disease, while Quintana is also called as Rochelimi quintana, also called as Rickettsia quintana. The species Quintana has Bartonella quintana, Rochelimi quintana, Rickettsia quintana as all other names. All of them can cause trench fever. Why am I telling you this? Because when they use the word Bartonella, you can be confused. Bartonella quintana is trench fever, while Henselae is cat scratch disease. Now, shall I tell you some important concepts in case of Rickettsia, apart from the stories? Yes, shall I tell you some kind of concepts? Concepts are a must for you to focus. So is it okay if I tell you a few concepts? Yes. Now, what are the most important golden rules? How can Rickettsia fetch you 100% marks? When you get a Rickettsia question, you should be 100% correct. Why? Because Rickettsia is a very easy topic, but because we don't spend a lot of time in remembering names, we may be missing out on MCQs. So that we can block it. We are not supposed to forget any of the mnemonics or any of these conditions or names in the future. That's why I'm telling you some important concepts. Listen very carefully. All Rickettsia are obligately intracellular. All Rickettsia are obligately intracellular organisms, except Rickettsia quintana. You tell me, people, it causes what disease? We have discussed it threadbare. Tell me, Rickettsia quintana causes what disease? All Rickettsia are obligately intracellular organisms except Rickettsia quintana, which is an extracellular organism. Tell me, Rickettsia quintana causes what? Excellent. It causes trench fever. Okay, so we have told the stories all these while. Now let's go forward. All Rickettsia are obligately intracellular organisms except Rickettsia quintana, which causes trench fever. Second thing, all Rickettsia have attraction towards. All Rickettsia have tropism. Tropism means what? Attraction. Towards what? Endothelium of the blood vessels. They all have attraction towards endothelium of the blood vessels. Imagine if this is a blood vessel. These are the endothelia. Now, there are two organisms, two bacteria who are known to attack endothelium of blood vessels. How? Which are the ones? One is meningococcus. What does meningococcus do? Meningococcus will use endotoxin, toxin-based separation of endothelium. When the endothelium separate, through the space, the blood will leak. Because the toxin did not injure any area, it is painless. So in meningococcal infection, you can have painless petechial purpuric hemorrhages because meningococcus operates through endotoxin. While the second organism who can attack the endothelium of blood vessels would be Rickettsia. I repeat once again, there are two major bacteria known to attack the endothelium of blood vessels directly. One is meningococcus, but meningococcus uses a poison, toxin, to separate the blood vessels. There is no injury. But Rickettsia will not use the poison. Rickettsia will use the property of invasiveness. It becomes a screwdriver like this. It becomes a screwdriver and screws into the endothelium. As it injures the endothelium of blood vessels, there is injury. Free nerve endings are involved. When free nerve endings are involved, then there is increased stimulation of the nerve endings. It can cause painful eruptions. So in case of Rickettsia, because the Rickettsia are directly invading the blood vessels, the endothelium of the blood vessels are injured, you can have painful vascular eruptions. Painful vasculitis is the property of all Rickettsia, except an organism called as Coxiella Burnette. Except Coxiella Burnette. Why? Coxiella Burnette is known for causing, I'll write it here, except Coxiella Burnette. Coxiella Burnette is known for causing Q fever. What is Q fever? It is a type of pneumonia attacking your lung. It is not attacking your skin. I repeat once again, Coxiella Burnette is an exception because there is no vasculitis. No vasculitis in case of Coxiella Burnette. It is not affected by vectors. It is coming through inhalation. And as it is inhaled, it is causing atypical pneumonia. So all other rickettsial infections can attack your skin and can cause vasculitis. But this one is known for causing atypical pneumonia. And listen very carefully. All Rickettsia depend on vector bites. On vector bites for spread. except again Coxiella Burnette, except Coxiella Burnette, which can be spread through aerosols also. It can be spread through aerosols also. What am I saying? All Rickettsia definitely need a vector for spread. But Coxiella Burnette is because of being aerosol-wise spread, it does not depend on a vector for survival. Did you understand this? Did you understand this, people? Three major concepts I have told you. All Rickettsia are obligately intracellular except Rickettsia quintana, which is extracellular. All Rickettsia have tropism towards endothelium and they can cause painful vasculitis except Coxiella Burnette, who causes Q fever, which causes atypical pneumonia. And all Rickettsia depend on vector bites for spread except Coxiella Burnette, which can spread through aerosols. Now tell me, which Rickettsia does not spread through vector bite? Quick question. Which Rickettsia does not spread through vector bite? That is the mistake. I knew you will say this. I told you. Listen to this carefully. All Rickettsia depend on vector bite for spread except Coxiella Burnette, who can spread through aerosols also. Please understand, Coxiella can spread through vector bite also. Coxiella can spread through vector bite, but mostly it can spread through aerosols. So, there is no Rickettsia which cannot be spread by any vector. Did you understand this? There is no Rickettsia where you can say it is not spread by a vector. All Rickettsia can be spread by a vector, but Coxiella does not depend on a vector because it can be spread through aerosols also. Did you understand this point, people? Let me know if you want me to repeat again. Otherwise, I'll go forward. Okay. Now, this is the first question. Let's look at the first question once again. All the following, among the following, which does not belong to Rickettsia family? All of them belong to Rickettsia family. So the answer is none of the above. Orientia, Ehrlichia, Anaplasma, Neo-Rickettsia, Candidatus Neo-Ehrlichia, Coxiella Burnette. Okay. Which is the empirical drug of choice for most of the Rickettsia infections? Answer, please. Thank you. What is the answer? Excellent. This is a simple question to move forward. The right answer is doxycycline. In case of Rickettsia, the drug you can look for would be doxycycline. Erythromycin is not used. Third generation cephalosporins are not used because they are atypical bacteria. In case of atypical bacteria, cell wall is not properly defined. Cell wall not defined well. And what kind of drugs are cephalosporins? Those who attack the synthesis of new cell wall. They are cell wall synthesis inhibitors. Because atypical bacteria have no defined cell wall, cephalosporins cannot be used. Streptomycin can be used in case of plague. Okay, now look at this question. Which of the following statement is true? This is 2015 year question. Come on. A, B, C. Which of the following is true? Think about it. Scrub typhus, wheel Felix test negative. Neal-Moser reaction, RMSF shows scrotal necrosis. C, only protease vulgaris antigens are used in wheel Felix test. Which of the following are true? Okay. So, Manimeghale says all. Any other answer, people? Senthil Kumar says C. Vaibhav Kumar says B. Saram says all. Vikram Dev says C. This is 2015 question. Please understand, scrub typhus, wheel Felix test negative is an absolutely wrong answer because in wheel Felix reaction, OX-K is for scrub typhus. OX-19, OX-2 is for Rickettsia, which causes Rocky Mountain spotted fever. So, OX-K is positive for scrub typhus. So, option A is a false statement. A Neal-Moser reaction, RMSF shows scrotal necrosis, is a wrong answer. Now look at this. Neal-Moser. Moser and Neil, both of them are scientists. But Moser is coming through a word called as Moseri. There is an organism called as Rickettsia moseri. Mose always speaks about mouse. And mouse will be the vector, which is, mouse will be the reservoir called as, mouse equivalent is rat. That is domestic rat called as Rattus rattus. Rattus rattus and Rattus norvegicus. Norvegicus. These are the two rats which have been asked in your entrance exams. I'll write it here. Rattus rattus and Rattus norvegicus. These two rats are the reservoirs. And which vector will bite a rat? Come on, people. Which vector is known to bite a rat? See, this is a recent question. You have to expect this question in your exam. You can't say no to it. That's why I'm asking you. Tell me, which vector is known to bite a rat? Wherever there is a rat, around the rat, what is the vector you expect? Excellent. It is the rat flea. So, you have Rickettsia moseri, which is spreading from a mouse through a flea, and that is called as murine typhus. M-U-R-I-N-E, typhus. Murine typhus. I repeat, murine typhus. Murine indicates mouse borne, carried by mouse. This is also referred to as endemic typhus. These are the alternative names you have to know. That is why we actually fail in getting right answers for Rickettsia. Many times Rickettsia can go wrong. The MCQs in Rickettsia can go wrong. But we understand Rickettsia completely. Please mark my words. You will definitely get one question in your NEET exam. And you will definitely get that 1 mark completely if you follow this particular protocol. I'll repeat once again. Look at this part. I said Rickettsia moseri is the organism. This will be called as Rickettsia moseri because it answers positive for Neal-Moser reaction. And this moseri sounds like mouse, which is rat. Rat is the reservoir and the vector is the flea. It is flea-borne typhus. It can be sometimes called as flea-borne typhus, but because it is coming through a rat, you call them as murine typhus. Murine typhus has one more name called as endemic typhus. This endemic typhus should be differentiated from epidemic typhus. Endemic typhus versus epidemic typhus. Epidemic typhus sitting on the bike. Epi on the bike. Which bike? Kawasaki bike. It is Rickettsia prowazekii. Rickettsia prowazekii will be negative for Neal-Moser reaction, while Rickettsia moseri is positive for Neal-Moser reaction. That Rickettsia moseri has one more name called as Rickettsia typhi. So, in terms of bacteria, Rickettsia typhi and Rickettsia moseri are one. In terms of the disease caused by them, murine typhus, endemic typhus are one. Now, this should be differentiated from epidemic typhus caused by prowazekii. This will be negative, these will be positive. And look at the question here. Which of the following statement is true? Neal-Moser reaction, epidemic typhus will be negative, endemic typhus will show the scrotal necrosis. Scrotal necrosis is the positive answer for Neal-Moser reaction. That is, when you inject the organism into the scrotum of rabbits or the guinea pigs, the scrotum will go for necrosis and then adhesions will form. Such reactions, when they happen, that is called as a positive Neal-Moser reaction. That's called as a positive Neal-Moser reaction. So look at this question here. Neal-Moser reaction, RMSF shows scrotal necrosis is wrong. Endemic typhus, Rickettsia typhi causing the scrotal necrosis is the right answer. And please remember, in Wheel-Felix reaction, Proteus vulgaris antigens can be used. And they are the ones who are commonly used. Did I help you understand this question completely? Are you happy with the explanations, people? No. Rickettsia rickettsii is known for causing Rocky Mountain spotted fever. We are not speaking about Rickettsia rickettsii. This whole Neal-Moser reaction is done to differentiate between epidemic typhus versus endemic typhus. And both of them will have similar clinical features. But the difference is in epidemic typhus, I told you about the story, the gloves and socks, the sparing of the hands and palms will be there, soles and palms, that can be done. But in terms of serological test, epidemic typhus will be negative for Neal-Moser reaction. Endemic typhus will be positive for Neal-Moser reaction. Rickettsia rickettsii is RMSF. Nobody will be positive except endemic typhus causing Rickettsia typhi. Did you understand this? Balachandarji, did you understand my explanation? Nobody else will be positive except Rickettsia typhi. But primarily they are done to differentiate between Rickettsia typhi and that of Rickettsia prowazekii. No, Neal-Moser reaction gives positive only in case of endemic typhus. Okay, now answer this question. A patient presents with rashes all over the body, sparing palms and soles. He does not have a history of animal exposure. This condition may be associated with which of the following rickettsial infection? What is your answer? Yes, see, imagine yourself, if the story was not told to you and this came on your face just like another MCQ, then it would have been difficult. Now, because we trained ourselves so well, palms and soles sparing, rashes all over the body. Tell me, what is a vector now? Now you're good with this. What is a vector for this? Excellent. What is a vector for this condition? Sagar, RMSF is Rocky Mountain Spotted Fever. Yes, what is the vector for this? Yes, head louse is the vector for this particular organism. And what is the organism for epidemic typhus, people? What is the bacteria for the epidemic typhus, people? Come on. Yes, it is Rickettsia prowazekii. Very good. Kundan Kumar, C is not the answer, Kundan Kumar. This is not Rocky Mountain Spotted Fever. This is epidemic typhus. I have just now told them the whole story, how to remember. When there is a rashes in the palms and soles being spared, it has to be epidemic typhus. It can't be Rocky Mountain Spotted Fever. Okay, of the following, pick up the true statement about Brill-Zinsser's disease. Let me tell you what is Brill-Zinsser's disease. See, epidemic typhus is caused by Rickettsia prowazekii. This prowazekii in acute conditions will cause a disease called as epidemic typhus. And when this is actually being there for a longer time, long latent period, the same disease will be referred to as Brill-Zinsser's disease. It's called as Brill-Zinsser disease. The causative organism for both epidemic typhus and Brill-Zinsser disease is Rickettsia prowazekii. On that basis, tell me which is the right answer here. Yes, correct. What is the right answer for this question here? Is it A, B or C? No, it is not A, because less than 1 month is not chronic. Less than 1 month is not chronic. The chronic version of epidemic typhus is called as Brill-Zinsser's disease. The chronic version of epidemic typhus is called as Brill-Zinsser disease. So, latent period of less than 1 month is not enough. Severe form of recrudescence is not the right word because Brill-Zinsser disease is not severe. It is a very mild illness and it is there for several months. So this question is a repeat question, and in the future if you get this question, please do not make a mistake in this. The right answer is Brill-Zinsser disease is a mild version that is appearing for several months as a reproduction of epidemic typhus. And causative organism of both Brill-Zinsser and epidemic typhus is Rickettsia prowazekii. If you're okay with this, can we go to the next question? Shall we go to the next question, people? See, my goal is once you listen to this particular class, no matter what kind of question, Ramanan, that's why I'm writing all these words again and again on the other side also. By mistake, I'm writing it. By mistake, I'm writing it in this area, but I'm repeating this in this area again. Okay. As the diseases of rickettsial origin progress deeper, which of the following is not common? Okay, I was telling you something, right? See, my goal about this class is, at the end of this session, you should feel completely in control about rickettsial diseases, so that you will not be having any lag in your conceptual understanding. You'll also have not a lag in case of your factual understanding. Both facts and concepts and picture-based understanding should be easy. Sooner I'll show you picture-based questions also. Is it okay if I take some more time? See, I have to stop at 9 o'clock, but I started late. So I started at 8:15 because of the 8:11 because of technical issue. But if you're okay, I can continue for the next half an hour if you would wish to. Okay, so many people have given the answer. B, E, okay, C, okay, I have received almost all the answers. Okay, now look at this. The right answer is pustular rash. In disease of rickettsial origin, we're asking you, not common. Please understand the difference. They are not saying not present. The question is about not present. The question is about not common. Rickettsia pox is the only condition where pustular lesions may be possible. Pustular lesions may be possible in case of Rickettsia pox. Otherwise, in all the Rickettsia, we have macular, maculopapular rash. Eschar is a property of Rickettsia common, and Rickettsia can reach your lung to cause pneumonitis. When I use the word pneumonitis, is it typical or atypical? If I use the word pneumonitis, it is typical or atypical? Remember this golden rule. When it comes to typical bacteria, you will have pyogenic pneumonia, which is typical pneumonia. In case of atypical bacteria, who are the atypical bacteria? Rickettsia chlamydia, mycobacteria, mycoplasma, and you'll be having Legionella and also spirochetes. All atypical bacteria will only cause atypical pneumonia. So, pneumonitis is an example of atypical pneumonia, and one organism among Rickettsia who can consistently cause pneumonia would be Coxiella Burnette, and Coxiella will cause atypical pneumonia. Meningoencephalitis, when I use the word, typical bacteria and all the typical bacteria are known for causing meningitis, while atypical bacteria can cause meningitis, but atypical bacteria and viruses most commonly will cause encephalitis. When you go for viruses, in viruses, you'll never come across septic pneumonia, you'll never come across septic meningitis. You'll come across either aseptic meningitis or most commonly it will be encephalitis. So meningoencephalitis is the zone which can easily differentiate between that of bacteria and that of viruses. Because Rickettsia come at the fag end of all bacteriology, the end of bacterial sessions of Rickettsia will be flowing over to viruses. So, in case of Rickettsia and chlamydia, you can see features of viruses, which is meningoencephalitis. In this question, I have not only told you the answer, I have also told you what is the logic behind choosing which option. So, in the question, the right answer is pustular rash, because pustule is not common, but maculopapular rashes, eschar, pneumonitis, meningoencephalitis, all are common in case of rickettsial infections. Did you understand this? Put a thumbs up if you think I can go to the next question. Okay, so this is the theory. These are the clinical manifestations. They can vary from one bacteria to the other, but these are the common ones: macular, maculopapular, vesicular rash, eschar, pneumonitis, meningoencephalitis. Now let me take your time to teach you something about eschar. What is eschar? This has fetched 74 MCQs in the last 10 years over multiple exams. In the last 10 years, 74 MCQs have been asked with respect to eschar. Now, let me give you a simple understanding. Eschar is caused in bacteriology in three conditions. Eschar in bacteriology is in three conditions. One is anthrax. The second one is plague. Anthrax is caused by Bacillus anthracis. Plague is caused by Yersinia pestis, and eschar is also caused in case of rickettsial infections. Rickettsial infections. Let me repeat. Anthrax, plague, rickettsial infections will have eschar. What is eschar? Eschar is combined denaturation of proteins plus dehydration of carbohydrates present on the skin, present on human skin. See, eschar is also found in case of rickettsial infections. I am telling you there are three major conditions: anthrax, plague, rickettsial infections. Now, what is the difference? What is the difference between the eschar formed in case of anthrax and plague on one side, rickettsia on the other side? I repeat, eschar means combined denaturation of proteins and dehydration of carbohydrates present on human skin. So, you will have a black plastic-like layer, black burnt plastic-like layer on the human skin. The difference is that in anthrax, Bacillus anthracis, the bacteria causes eschar. In case of plague, Yersinia pestis, the bacteria causes eschar. But in rickettsia, the vector bite is the one who causes eschar. The bite of vector will release acid. For example, if a small ant bites you, when a red ant bites you, the pain lingers for more than 10 minutes. Why? Because the red ant in its tentacles will inject formic acid into your skin, because of which you will be having heightened sensitivity of touch and you'll be having pain and itchiness for the next 10 minutes. Likewise, bigger and bigger vectors can release acidic compounds. That vector bite is the reason for eschar, not rickettsia per se. Did you understand this? Did you understand the difference here, people? Please tell me if you understood the difference. Yes? Okay. Now, eschar is found in which rickettsia? Number 1 is rickettsial pox. Number 2 is scrub typhus. Number 3 is Indian tick typhus. Indian tick typhus. Some question papers will give you the word eschar. Some question paper will use the explanation or description of eschar. What will you say? They'll say black necrotic lesions with rim of edematous changes. This can be applicable for malignant pustule also, but black necrotic lesions with the rim of multiple small vesicles. You can have erythematous vesicles. For example, you'll be having vesicles like this, and the whole area will be black. This is how eschar will look like. The eschar is found in rickettsial pox, scrub typhus, Indian tick typhus. Now, when you see eschar, you have ruled out all the other rickettsia. You have ruled in rickettsial pox, scrub typhus, Indian tick typhus. I am teaching you how to use this information to crack questions. So when you see eschar, or they give you an explanation like this: erythematous lesion, black necrotic lesion, and erythematous lesions are surrounding the black necrotic lesion, that is also indicative of eschar. Eschar can be found in 3 conditions: rickettsial pox, scrub typhus, Indian tick typhus. Now, how do I zero in on the other conditions? If it is rickettsial pox, you will be having eschar plus pox-like lesions. What are the pox-like lesions? Pustules, vesicles, macules, papules. If you want to go in the order, flat regions called as macules become bumps called as papules. They'll have fluid called as vesicles, which turn into pus called as pustules. So these kind of lesions, if they are found along with eschar, it is pox. If eschar has no pox-like lesions, then it is not rickettsial pox. Remember, the only bacterial pox on earth is caused by Rickettsia acari, which is called as rickettsial pox. So all other pox lesions are viral poxes. The only bacterial pox is Rickettsia acari induced rickettsial pox. So if I have eschar, I can say it is rickettsial pox, scrub typhus, Indian tick typhus. If you want to know which among the three, then look for whether the pox-like lesions are seen. If no pox-like lesions, rickettsial pox is ruled out. If there are pox-like lesions, rickettsial pox is ruled in. Now say it is not rickettsial pox. Now you have to convince between scrub typhus and Indian tick typhus. How do you differentiate? In scrub typhus, you have additionally regional lymphadenopathy. Regional lymphadenopathy. So when they say eschar plus regional lymphadenopathy, it has to be scrub typhus. Did you understand this? If there is no regional lymphadenopathy, only eschar is present with vasculitic rash. All rickettsia will have vasculitis. So eschar plus mere vasculitic rash is Indian tick typhus, which is caused by Rickettsia konori. Cone ice cream, Indians like scrub typhus, Rickettsia tsutsugamushi. Scrubbing themselves properly, Japanese sumo wrestlers, Japanese name Tsutsugamushi. Did you understand the differential diagnosis? Whatever I taught you is the cleanest and the fastest way of making a differential diagnosis. Did you understand this? Tell me if you have any questions. Hello? Okay, so now look at this question here. High level infectivity and severe illness after inhalation making bioterrorism threats includes all the following organisms except. Okay, what is the answer to this question? See, all these organisms can be acquired by inhalation possibly, but they can cause severe illness. That is why they all can act as bioterrorism threats. See, Bacillus anthracis, smallpox, African hemorrhagic fever are all class 1 biowarfare agents. Among the following, which one is not a biowarfare agent? The answer is Anaplasma phagocytophilum. Anaplasma phagocytophilum. Anaplasmosis. Human anaplasmosis is what is caused. Human granulocytopenic, human granulocytotic, cytopenic, both can be possible. Anaplasmosis is caused by Anaplasma phagocytophilum. We'll do the vectors later. We haven't repeated vectors at all. So we have Prowazeki, Rickettsia, Typhi, Conorrhea, Burnette, all can act as bioterrorism agents. Please make a note of this because there will at least be one question biowarfare agents in your question paper. So the right answer here is only F, which is 0.5. Anaplasma phagocytophilum is a variant of the family of Rickettsia. This is what we discussed in the first slide itself. I told you Orientia, Ehrlichia, Anaplasma, Neo-Rickettsia, Candidatus, Neo-Ehrlichia, Coxiella. All of them are belonging to Rickettsial family. So none of them is the not answer. So let's go for this picture. Now we go for picture-based questions. Look at this. Which of the following is false regarding the picture? What do you think is the lesion here? What do you think is the lesion here? I have told you all the while about only one thing. What was the lesion we were discussing? Yes, the lesion is eschar. Okay, so now tell me, what is the false statement regarding the picture? This is the picture-based question directly taken from CDC website. It is taken from Center for Disease Control website, and the information is taken from microbiology textbooks and Harrison's textbook of internal medicine. Okay, what is the answer here? Which one is a false statement? A, B, C, D, E? Correct. Necrotic tissue plus peripheral edema. Very good. Anything else? What is your answer here? Which one is the false statement here? Saram says A, Kanchana Reddy says A, Paramita says B. Any other answer, people? The condition is known as bush typhus. The picture is caused by a bacteria called as Rickettsia Tsutsugamushi. Disease is spread to people through bites of infected chiggers. The most common symptoms include fever, headache, body rash, and sometimes rash. Most of these cases occur in rural areas of Southeast Asia, Indonesia, China, Japan, India, Northern Australia. See, whenever they give you these kind of statements, they can most probably be true. And when they speak about most common symptoms in any kind of infection, fever is common. Headache is possible. They say rash, you have to give it to it because all rickettsia are rashes. So D and E will not qualify to be a false statement. And in case of the diagnosis, what is the diagnosis? A bush typhus. Yes, that's a good question. This is called as scrub typhus. And scrub typhus is also called as bush typhus. This question is to teach you something new. Please understand, you're looking at eschar. I told you in eschar we have anthrax, plague. In case of rickettsia we have scrub typhus, we have Indian tick typhus, and we have rickettsial pox. Now this is not having any pox-like lesions. You can think of Indian tick typhus, but the clinical features are, none of the questions are similar to that of Indian tick typhus. So bush typhus is the other name for scrub typhus, and the picture is caused by a bacteria called as Rickettsia Tsutsugamushi. Do you think it is true? If it is scrub typhus, do you think option B is true? Paramita is the only person who says no. What did I teach you all the while? I told you here very clearly in all the other conditions. I told you eschar, right? I told you in case of eschar, the bacteria in case of anthrax, the bacteria in case of plague is causing the eschar. But in case of rickettsia, the vector is causing the eschar, not the bacteria. I repeat, it is the vector that causing the eschar. What is the vector here? It is trombiculid mite. Trombiculid mite is the vector who causes the eschar. Scrub typhus is caused by the Rickettsia Tsutsugamushi. Rickettsia Tsutsugamushi is caused by scrub typhus. But the picture is eschar. Eschar is caused by the vector, not by the bacteria. Did you understand this? Excellent. So let's go for the answer here. What is chigger? Chigger is the other name for trombiculid mite. And generally, adult chiggers will not spread. The larva of the chigger will spread. So it is bite of the infected chiggers. And please remember, the bite wound is by the bite of the chiggers. So adult chigger is this one, larval chigger is this one. Chigger is the word I am repeating so many times so that you will not forget about scrub typhus. Okay. Name the agent among rickettsia that has been documented to cause chronic illness. Okay, so Saram says ye, he thinks it is Rickettsia prowazekii. Okay. Minutes. Okay, please understand, when it comes to chronic illness, the answer would be Coxiella Burnette. Look at the explanation as given in Harrison. This is Harrison's based information. Only one agent, Coxiella Burnette, has been documented to cause chronic illness. The atypical pneumonia can become chronic. Atypical pneumonia can be chronic. All rickettsial infections are acute. All rickettsial infections are acute. If possible, they can be subacute. Now you'll have a question. Sir, you told me about Prowazeki, you told me about Brill Zinsser's disease. Yes, listen very carefully. One other species called as Rickettsia Prowazeki causes recrudescent illness. You don't call it as chronic, you call it as reactivation or recrudescent illness. Recrudescent, the latent illness is getting reactivated is what we have to know, but it is not chronic. There is a resolution of acute illness. Brill Zinsser is a recrudescence. It is not a chronic illness. The patient will have a space before he is attacked again. Did you understand this part, people? Okay. Now look at this question here. Maculatum disease is caused by Rickettsia parkeri. Because we are running out of time, let me tell you data alone. Maculatum disease is caused by Rickettsia parkeri, and Rickettsia parkeri is spread by tick bite. Now remember, A stands for amblyoma. A stands for amblyoma. A stands for amblyoma. Maculatum disease is caused by Rickettsia parkeri. It is caused by tick bite, and the tick are amblyoma maculatum, amblyoma tristae, and amblyoma trigrinum. Now, this will be a question. We'll do two more picture-based questions. Is it fine? Okay, what is the answer to this question? Pick out the true statement about the disease related to the given vector. First, you have to say what vector it is. Once you know the vector, you have to say whether the statement is true or false. The vector spreads a disease caused by Rickettsia typhi. This vector becomes infected when the bite infected animals such as rats, cats or opossums. When they bite the infected animals. See, when infected vector, this vector bites a person or animal, the bite breaks the skin causing a wound. D. The feces of the vector rubbed into the bite wound causes infection. People breathe in the infected feces or rub it into their eyes. F. This bacteria is not spread from person to person. G. This disease is common in United States of America. Because it's a Harrison-based question, you will be thinking about United States. Don't worry about anything else. Excellent. Bhargava Sitaraju says it is rat flea. It is rat flea. So pick out the true statement about the disease related to the given vector. Is it 1, 2, 3, 4 or 5? Is it A, B, C, D, E? Is it A, B, C, D, E, F? Is it B, C, D, E, F, G? Is it all the above? Is it none of the above? Tell me whether option A is true or false. Okay, let me not wait for your answers. Let me tell you the answers. Option A is true. Why? Because rat flea is going to bite a rat. Rat is the mammalian reservoir for murine typhus. Murine typhus is also called as endemic typhus. We have discussed this already. Murine typhus is endemic typhus. It is caused by Rickettsia moseri or caused by Rickettsia typhi. So on that basis, the rat flea will spread the disease. What is the disease? It is murine typhus or endemic typhus, and that is caused by Rickettsia typhi. True statement. And B, the vector becomes infected. How does the flea become infected? When the flea is biting infected animals. Which animals are they? Rats, cats, opossums. They can be 4-legged animals or 7-legged animals. Sorry, 8-legged animals. When infected, vector bites a person or animal. The bite breaks the skin causing a wound. Yes, this is called as the definition of inoculation. Rat flea will bite and spread murine typhus is inoculation. So A, B, C are true. The feces of vector rubbed into bite wound causes infection is a true statement. Remember, when the rat flea bites you and gives you the fecal material, then you scratch the area. Because you scratch the area, the feces will go into your skin, because of which you get the infection. Similar picture is seen also in case of reduvid bug. In reduvid bug, which causes Trypanosoma cruzi, the vector is called as kissing bug. It is not something that is biting. It comes and kisses you, touches you, and defecates. When you have an itch, when you scratch yourself, through the scratch, the fecal material will go into your skin. That is how it spreads. So this rat flea is unique because it can both bite and shit, which is it can deliver the fecal material here. So rat flea, rat, murine typhus, Rickettsia, Moser. Okay, Chagas disease. Except G, all are true. Why? Because the bacteria is not spread from person to person is true, but not common in the United States. This question is just to show you the possibility of making a mistake even with a very small trivial point. It is not common in the United States. It is very common in the developing countries. And this answer would be A, B, C, D, E, F, which is option 2, not all the above. Do not jump into all the above or all the above without knowing every single option properly. That is the message that I'm giving you as a take-home message. Now, not true about scrub typhus. This is a PG Chandigarh 2013 and 2017 question. Tell me, what is the wrong statement here? Okay, listen very carefully. Many of you are giving you multiple options. That's a good thing. But Paramita is the only person who's given the absolute right answer. See, scrub typhus is spread through trombiculate mite and it is referred to as chiggers. Vector is mite, that is true. It is caused by Oriensia sutsugamushi, true. It has 3 serotypes, that is also true. It is not a chlamydial illness. What are the 3 serotypes of Oriensia sutsugamushi? They are carp, gillium, cato. Please take a note of this. This is very important. If you did not know it now. Carp, gillium, cato. Okay, now tell me the answer to this question. Okay, you don't have to give me the answer. I'll give you the answer. Name the condition where humans are incidental hosts. Rickettsia pox, scrub typhus, louse-borne typhus, Mediterranean spotted fever. Now, among the 4, the right answer would be louse-borne fever. Okay. I'm sorry, this is not accept. Name the condition where humans are incidental hosts. It is louse-borne typhus. Have a look at this. The right answer is louse-borne typhus. What do you mean by incidental host? It means the host human being can have come under accidental conditions, or he'll be a dead end host. It means human is not a primary host. Not a primary host. In case of Rickettsia pox, scrub typhus, Mediterranean spotted fever, in all the areas, human beings are definitely the normally expected hosts. But in case of louse-borne typhus, they are not expected. Look at the explanation here. Epidemic typhus, also called as louse-borne typhus, is an uncommon disease caused by a bacteria called Rickettsia prowazekii. Epidemic typhus is spread to people through contact with infected body lice. Infected body lice, though epidemic, is actually responsible for millions of deaths in the previous century. It is now considered a rare disease. Occasionally, cases continue. Human beings have come as an accidental host. And please remember, in case of Akari, scrub typhus, Mediterranean spotted fever, we expect them to have infection. Okay, we'll do one more picture-based question, and with this, we'll stop the session. Tell me, among the following, which statement is true regarding the given picture? Okay, Vikram, they were saying A, that is A, B, C, B, C. Okay, the options are A, B, C, B, C, D, C, D, E, A, B, C, D, A, B, C, D, E. Any other answer? Okay, Mohit says 3. Bhargava says 5. Can you tell me the diagnosis? Okay, what is the diagnosis? Excellent. This is a case of rickettsial pox. And if it's a rickettsial pox, it is Rickettsia acari. Now, how do I make the story more compelling? I told you, you call your Akka and Anna. You say you don't have food. Anna says, I may come, I may not come. He says, I might come, I might not come. But Akka says, definitely I'll come. I won't come empty-handed, I'll bring a box. The box contains food. So, Anna says he might or might not come. Akka says she definitely comes with the box. Box is pox. Akka is akari. So, in akari, you can have might as the vector. I might come. Might as the vector. This is how we finish the story. Did you understand this part? So, this is a teaching MCQ. All of them are true. The bite develops a central vesicle and becomes a 1 to 2.5 centimeter painless black crusted eschar surrounded by a erythematous halo. See, you have eschar and you have pustular lesions, and you have to understand this coming through mite, because if you focus on scrub typhus, that also might have come with mite. But in scrub typhus, they would have given you different kind of clinical feature, because they would have said there is lymphadenopathy. They did not speak about lymphadenopathy, but they are saying there is crusting that is healing without scarring. Patient develops nausea, vomiting, abdominal pain, cough, congenital photophobia. All these are possibilities of rickettsial pox depending on where the pox lesion happens. And without treatment, fever lasts for 6 to 10 days. And please remember, this particular slide, this question is a direct statement from Harrison, and every single line in the statement is true. These are the statements. Have a look at it. The incubation period is 10 to 17 days. That is approximately 1 fortnight. That is approximately 15 days, half a month. And you have a central vesicle becoming a 1 to 2.5 centimeter black crusted eschar surrounded by an erythematous halo, and there is a lymphogenous spread, but enlargement of lymph node draining the eschar suggests initial lymphogenous spread. And you can look at macular rashes. These macular rashes, papules, vesicles, crusts, all are indicative of rickettsial pox. If they did not say any of these things, it would have become scrub typhus. This question would have easily become scrub typhus if this option D was not there in the question paper. Did you understand this part? Okay, we'll do one more question. Have a look at this. Rickettsial diseases are traditionally separated into typhus and spotted fever groups based on what? On the basis of what? Okay, Paramita says B. Let me tell you, this is a very unexpected answer. You will have unexpected answers. Paramita says B, Abhi Sundar says B. Any other answer? Okay, Mariana says B, AK says B, Senthil Kumar says B, Bhargava Sitraju says B, C, D, E. This is a one single question. See, if it is a multiple choice question, I have given you multiple choices also. Okay, so the right answer is lipopolysaccharide antigens. None of them matter in the differentiation between typhus and spotted fever groups. This is given by the statement. The diseases caused by organisms of genera Rickettsia and Orientia in the family Rickettsaceae result from endothelial cell dysfunction and infection and increased vascular permeability. Pathogenic rickettsial species are very closely related, have small genomes, and are traditionally separated into typhus and spotted fever groups on the basis of lipopolysaccharide antigens. So, classification of all these typhus and spotted fever is based on LPS present on the outer membrane of gram-negative organisms called as. Classification is based on LPS of the gram-negative organism called as Rickettsia. This information is unexpected, but this is given in Harrison. I just wanted you to know this. Okay, so there are many things more, but it will be very difficult for you. Shall we focus on one last MCQ? One last picture-based MCQ? Okay, What is the answer for this question? Liponissoidus sanguineus is what? What is the answer? See, this is the last question. For those people who had questions about vectors, we'll teach about vectors in this particular question. Liponissoidus sanguineus is what? Abhi Sundar says A, Senthil Kumar says B, Kumar Vendani says B. Any other answer? Mohit Arora says A, Arindam IT says B, Nupur Singh's A. Okay, so the right answer is mite. Please understand, Liponissoidus sanguineus is a mite. And look at this. This is how a mite will look like. This is how a mite will look like. Now, there are some students who will ask me, sir, how can I differentiate between a mite and a tick? Both of them look the same under microscopy. The answer is whether you need a microscope or not. Whether you need a microscope or not. That is the answer for your question. See, both can be seen under microscope. But who requires a microscope? Who can be seen without a microscope? That differentiates between mite and a tick. Now, what you're seeing here is a mite. If you watch very carefully, can you notice hair-like projections coming out here? See, this is the picture question. Liponissoidus sanguineus is a mite. I'm just showing you this particular picture to differentiate between mite and tick. And I'm showing you this is the tick. This is the mite. In the mite, you can notice the vector showing you different kinds of hair-like projections outside. Now look at the differences. With this, we'll end the whole class. Listen very carefully. This is a tick. And the tick will be having this zone. That zone is called as capitulum. Capitulum is very important in a tick. Now imagine, tick has a capitulum, mite has a very thin capitulum. But when the tick bites, the capitulum is deposited inside the tissue. While when the mite bites, the capitulum is not very strongly bound to the area. Now, whenever there is a poisoning because of tick-based diseases, the first important activity you have to do as a doctor is remove the tick. When you try to remove the tick, the capitulum will break and the capitulum will remain inside the human being, and the pain will be extremely high for the patient when you try to remove the tick. But in the mite, the capitulum will come out along with the mite. This is one difference. Now look at this. Tick can be seen with naked eye because they are generally 1 millimeter long. But you will not be able to have mites because mites are microscopic. Point number one. Point number one. Second, ticks have short hair. Now, whatever you see, you don't have hair at all. But in case of mite, you'll be having hair everywhere. That is, if at all I draw a line like this, you'll be having bristle-like hair everywhere. Look at the picture in a complete landscape mode. You'll be able to differentiate the pictures here. You'll be having hair projecting outside. Now, hair is important. Mites have long hairs on their bodies. The next thing is hypostome. This particular apex area is called as hypostome, and the mites and tick capitulum are different. With ticks, the hypostome is visible and contains barbs that point back towards their bodies. Now look at this. This is how the tick will be present. This is the capitulum. The capitulum I'm showing you here is belonging to a tick. Can you see the serrations here? With the serration, if the tick is entering and projecting into the skin, the moment you try to pull it back, the tissue will go like this and get hidden by the particular area. So when I try to pull this back, the tissue will be destroyed. So it will be extremely painful. It will be extremely painful. So look at it. With ticks, the hypostome is visible and contains barb that points back towards their bodies. It is inserted into the host and serves to very effectively anchor itself to the host. So tick anchors strongly. Tick anchors strongly to the host. When you try to pull the tick out, the capitulum is deposited back while the capitulum is separated from the rest of the tick body. This is how you have to differentiate. So what you're seeing here is tick. what you are seeing here is a mite. In this, the capitulum will be sticking inside, while the mite will not have its capitulum sticking inside. Now look at this. All ticks live off the other organisms. Mite can feed on plants and animals, while ticks strictly live on animal hosts. Okay, look at this. This is the last thing I would want to teach you. This statement is true or false. Antibiotic treatment is a strategy for filariasis control. This statement is true or false. Remember, in Rickettsia family, there is a variant bacteria called as Wolbachia or Wolbachia. This Wolbachia lives inside filarial worms. When Wolbachia is present as a commensal inside the filarial worms, that filarial worms can be extra virulent and they can be more dangerous. I repeat once again, Rickettsia variant is another bacteria called as Wolbachia. I'll write the spelling here, Wolbachia. This lives as a commensal inside the filarial worms. When a filarial worm contains Wolbachia, then the filarial worm is extra virulent and dangerous. So antibiotic treatment can be a strategy for filariasis control. How? Because when you give an antibiotic to kill the Wolbachia, the virulence of filariasis worm will come down. So Wolbachia increases filarial virulence. Now there is one more opposite information you have to know. Wolbachia will decrease dengue virulence. Dengue virulence because it will go back and destroy Aedes mosquito. Aedes mosquito also can be infected by Wolbachia. All these are information you do not know. That is why I'm telling you. These are new world information. These are highly updated information from Harrison. Do not make a mess out of this. Do not miss out on any of these questions. Wolbachia can be a part of filarial worms. It can be a part of Aedes aegypti mosquitoes like this. But when Wolbachia infects a filarial worm, the virulence of filaria increases when they attack human beings. So when I give an antibiotic and I kill Wolbachia, filarial virulence will come down. And Wolbachia, if it lives in Aedes mosquito, it will bring down the virulence of dengue virulence because Aedes multiplication can be brought down. These are the two things I would want you to know from this class. So with this, I'll complete my session. We have discussed as many questions as possible. I have told you as many stories as possible. Just go back and revise the stories and see whether they are helpful for you. And for those people who would like to have any referral, you can use the code DRASM Live. If you would want to subscribe to Unacademy, DRASM Live. I have shown you there are a lot of plus classes I have taken, and if you would use this referral code, you can have a 10% discount on your subscription, and you'll have exclusive access to all my 54 hours of class that I took for the next PG session on microbiology, and you'll be having exclusive access to all the previous immunology, biochemistry sessions also. And this is how you can follow me on Telegram, and you can ask your questions. A simple idea here tomorrow. Yes, for if you want to approach Unacademy especially, you can subscribe to Unacademy Plus courses using the code, and you will be having 54 hours of complete in-depth understanding of microbiology to learn everything. And one more thing, on 25th, that is on Thursday, we have one more session on Harrison-based tuberculosis. There is a session on tuberculosis on 25th, that is Thursday, day after tomorrow. So all of you have been very kind enough to listen to my classes so patiently. It was a lengthy class, but still I'm really thankful. I repeat once again, 25th, that is day after tomorrow, on Thursday, we have a similar Harrison-based data for tuberculosis. I hope to see you there in that particular class. Thank you so much. Have a good night. Bye-bye. Great.